Every year, thousands of older adults dismiss a leg symptom as just circulation or just getting older, when it was actually their body's clearest early warning sign of a vascular problem, one that's highly treatable when caught early and far more dangerous when ignored for months. I'm not here to alarm you, I'm here to explain the why behind 3 specific leg symptoms that vascular specialists consistently flag as worth a real conversation, not a shrug. Today, what each one actually means inside your blood vessels, and exactly when keep an eye on it turns into call today. Stay with me to number 1. It's the one that can turn from a minor ache into a genuine emergency in the space of a single day, and knowing the difference in advance could matter more than almost anything else in this video. Before we start, tell me your age and where you're watching from. I read these, and they shape what I cover next. A quick note, this channel is for general education, not medical advice, and I'm not your doctor. Nothing here is a diagnosis. Always talk with your own doctor about any new or changing leg symptom. Here's what almost no one explains. Your legs depend on 2 completely separate delivery systems working correctly. Arteries carrying fresh, oxygen-rich blood down to your feet, and veins carrying blood back up to your heart against gravity. After 65, both systems can lose a little efficiency, but they fail in very different ways and produce very different symptoms. Arteries narrowing means less blood gets down to your tissue that shows up as pain, coldness, or poor healing. Veins, struggling to push blood back up, means blood pools that shows up as swelling and heaviness. Once you know which system a symptom points to, roughly how urgent it is, name plus frame. We start here because it's the slowest, quietest signal on this list and the easiest one to underestimate. Mechanism. When arteries feeding your lower leg have narrowed over years, less oxygen-rich blood reaches the skin and tissue there. Skin that isn't getting adequate blood flow simply can't repair itself at a normal pace. A minor scrape or blister that would heal in a week anywhere else on your body can linger for a month or longer on a lower leg with reduced circulation. Analogy? Think of it like trying to repair a road with a supply truck that keeps getting stuck in traffic. The materials for the repair simply aren't arriving fast enough. Evidence drop. This is a well-documented feature of peripheral arterial disease, and it's specifically why non-healing lower leg or foot wounds are one of the standard screening triggers vascular specialists watch for, particularly in anyone with diabetes or a history of smoking. Prescription. Any sore, cut, or blister below the knee that hasn't visibly improved within 2 to 3 weeks is worth showing to your doctor, not because it's automatically serious, but because catching reduced circulation early gives far more treatment options than catching it late. Bridge. The next one shows up not while you're resting, but specifically while you're active and then does something unusual. Name plus frame. This is a very specific pattern pain or a tight cramping ache in your calf, thigh, or buttock that comes on after walking a certain distance and then fades within a few minutes of stopping. Mechanism. This pattern has a name claudication, and it happens when narrowed arteries can supply enough blood to your leg muscles at rest, but not enough to keep up once those muscles are working and demanding more oxygen. The pain is your muscle tissue, essentially running out of fuel partway through the walk. Analogy. Think of it like a delivery truck that can handle a quiet street just fine, but falls behind the moment traffic demand picks up. Evidence drop. This exact walk then rest pattern is considered one of the most recognizable and specific signs of peripheral arterial disease in vascular medicine, precisely because it's so consistent from one episode to the next. Prescription. If you notice this pattern, especially if the distance you can walk before the pain starts has been shrinking over recent months, that's worth describing to your doctor in those exact terms. Where it hurts, how far you walk before it starts, and how long it takes to ease. That specific pattern helps guide exactly what testing makes sense. Bridge. And now, the one I asked you to stay for because unlike the first 2, which build gradually, this one can appear within hours. Name plus frame. This is the biggest one on this list because the timeline matters as much as the symptom itself. Mechanism. When a blood clot forms in one of the deeper veins of the leg, a condition called deep vein thrombosis, it partially or fully blocks blood from draining back up toward the heart. Blood backs up behind the blockage, and the leg swells, often with pain, warmth, and redness, usually appearing in one leg only, not both. Analogy. Think of it like a clog partway down a drain pipe. Everything upstream of the clog backs up and the pressure builds. Evidence drop. Sudden, one-sided leg, swelling with pain is considered a classic presentation of deep vein thrombosis in vascular medicine. And it's treated with urgency precisely because of what can happen if a piece of that clot breaks loose and travels to the lungs, a pulmonary embolism, which is a genuine medical emergency. The line between nuisance and emergency. Gradual, mild swelling in both legs by evening, especially if you've been sitting for a long flight or car ride, is common and usually not dangerous on its own. But swelling in one leg only, especially if it came on within a day or two, especially with pain, warmth, or redness, or any shortness of breath or chest pain alongside it, that combination is not a mention it next week situation. That is a same-day call to your doctor or emergency care if you also have chest pain or trouble breathing. Prescription. Don't wait this one out to see if it improves on its own. One-sided, sudden leg swelling with pain is worth same-day medical attention. Full stop. Bridge. Every item on this list shares one thread worth naming plainly before we close. Consider a man in his early 70s, call him Robert, who noticed his right calf had become swollen and tender over the course of about a day and a half, and assumed he'd simply strained it gardening. He waited nearly a week, hoping it would settle on its own, before mentioning it during an unrelated appointment. It turned out to be exactly the kind of one-sided swelling this video describes, and it was caught and treated before it became anything more serious. But the week of waiting was the one part of the story that genuinely didn't need to happen. Here's why this matters together. Your arteries and veins fail in different ways on different timelines, and knowing which pattern you're looking at is what tells you whether something is worth mentioning at your next visit or worth calling about today. None of this is a reason to panic over every ordinary ache, but a non-healing sore, a consistent walk, then rest pain pattern, or sudden one-sided swelling are three specific patterns worth taking seriously every time you see them. Tonight's simple plan. Take a slow look at both of your lower legs and feet. Right now, any sores that haven't healed, any noticeable size difference between the two legs, any skin color changes. If you see something that's worth a phone call this week, not a someday. If this helped, type the number 1 inch the comments for the one worth acting on the fastest. And tell me, have you or someone you love ever noticed one of these three? Your answer might help someone else reading these comments recognize it in time. There's a related topic we haven't covered yet, the specific changes in your feet that can be an even earlier warning sign, sometimes showing up before any leg symptom at all. That's the video I want you to watch next.